I'm so excited to be here with you, Arnie, to
Thank
talk
you.
about the biggest issue we seem to be having across the country, which is homelessness. You know, I got elected in 2019 to the city council, and one of the first people I was introduced to was you. And I thought you were doing amazing things, not just for our veterans, but for people who found themselves on the street. And as you and I both know, mostly mental health and addiction.
Correct. Thank you for having me, by the way.
Oh, you're welcome. So tell people how you got involved with this issue of homelessness.
Well, my first involvement was when I was a student intern in the late 1970s. So it's a long time.
Long time.
And what was true then is true now. You can't solve this problem by spending your way out of it, and you can't solve this problem without a plan.
Yeah, and isn't that what governments do? They just keep throwing more money at it and really not going to the root issue. Like you and I both know, you have to have that plan for these people, especially people who have mental health issues, people who have PTSD as a veteran, and that's what you started out with, was helping veterans. Mm-hmm. And the thing that bothers me the most is they don't look at the issue, the root cause, which really is addiction and mental health.
It's addiction, it's mental health, and it's the total lack of available affordable housing.
Yeah.
Without housing, you can't solve the problem.
But that's what you did here.
Well, we have a model to solve it, yes.
So tell people about it.
So the model is, it's actually quite simple. You know, one of our taglines on our letters are, you can't solve the affordable housing crisis without building affordable housing. Yeah. And so it's a lot of the things that I have to do in my life is simplify them like a mathematical equation. Simplified. What's the problem? Lack of housing. Why do we have a lack of housing? And that's where it becomes complicated. You know, there's a lot of people from every walk of life that I've met agree that there's no reason that anybody should be homelessness in the United States of America. There's no reason for it. The solutions have been convoluted over the decades of how to solve it. There's been wars on poverty, wars on drugs, wars. We've had a lot of people that have announced a war, but haven't fought it like a war.
Right.
Haven't finished it.
But we do know there are folks out there that want to stay out there due to their drug use.
Oh, absolutely.
You know, but I think you're talking about the majority. I think you're talking about those folks that do find themselves on hard times and they can't get out of the perpetual situation that they're in, and they need someone to help them maybe find their benefits, mm-hmm.
find
that affordable housing.
Mm-hmm.
And I know that you've been helping veterans for a very long time.
Long time.
And, you know, tell us about when they come to you, how you get them into that housing. You get their benefits, you make sure you put them through programs or send them where they need to go. Please tell us a little bit about that.
Well, the term collaboration and partnership is thrown around a lot. To us, it means we work with others who do things that we can't do. What I mean by that, there's a handful of agencies that actually provide affordable housing with case management, and then there's agencies and that do things that support that, the supportive services. Whether it's a food pantry, which we've been doing for 18 years now with 3 Square.
Yes, I've been there. It's an amazing pantry, and you do that a couple times a week, right?
We do it once a week.
Okay.
And then every third Thursday we call a super pantry. So it's a supply chain that's consistent, and that's another problem, is that a lot of the services are pop-ups. They pop up, they do the service, and
then where do they go the next time?
You don't.
Yeah, exactly.
And
you have consistently done it in the same
mm-hmm,
place for
mm-hmm,
how many years?
Essentially. The current one, we're there about 12 years, but we've been in service in downtown Las Vegas for 18 years now, almost 18 years now.
So what I do know is people call Shared Village, and right away people start working on their case and send them where they need to go, right? Whether it's getting housing right away, or you work with other agencies to get them, some sort of recovery. What are some of the groups that you work with here in Las Vegas?
So as technology has changed over the years, it used to take us about an hour to triage a veteran or a veteran spouse or a veteran connected person or family. Now it's all in the palm of your hand. You go to Share Village, Las Vegas, at the App Store. It's another thing I learned. And I'm real old school in a lot of things, but technology is an amazing thing when it works. So there's a whole host of agencies on that app, whether it's housing, whether it's food, whether it's a crisis situation like a veteran or anybody contemplating suicide, whether it's a job.
What about
workforce
addiction?
Addictions
or
also,
mental health?
Yeah, there's 4 or 5 different agencies on there, and it depends on what that particular person's problem is. If it's a veteran, if the person's a veteran, go down to the CRRC on East Charleston. It's a one-stop center. It works very well. And to a veteran that has their paperwork, a DD-214 paperwork, they can get connected to a caseworker if they're willing to go and spend the time, wait in line, get seen, and they've got that down now. To see what connection they can make. If they don't make that connection there, they can go to U.S. Vets, they can go to Salvation Army, they can go to any host of Help of Southern Nevada, all sorts of Shine a Light Foundation.
I love Shine a Light. It's amazing.
Yeah, they do a lot of good work.
Yes.
And so all those agencies that I mentioned are funded, have vouchers, and they're there to triage people and help people.
So what I love about your organization and so many others here in Southern Nevada is that they kind of start where you need to start. I see places in California that just, put them in a bunch of motel rooms or let them camp out on the street. That is not going to the root cause and finding the solutions. And what I love about our nonprofits here, like yourself, like Shine a Light, is that they really do this triage and get them into the services they need, because it's not, homelessness isn't a one issue thing.
Right.
It's, everybody has a different root cause and needs a different solution. And what I love about this is that you look for the actual solutions for the individual. And, that is so important because government doesn't have it right. I mean, we're doing the Campus for Hope, which I think is a big step after, our shelter, which, as I know, the city couldn't do it all. And we just didn't have the funding and, the resources. But when nonprofit does it, or it's a public-private partnership, that is where we can see good results, because we have about 8,000 people on the street here. It's nothing compared to our neighboring cities, bigger cities. However, like you said, no one should be on the street. I mean, there are people who choose to, and unfortunately, we can't do anything about that. I've been out with Shine a Light in the tunnels. I've talked to people who are in addiction, and in the hot sun in their tents, they say, we want to be here. We want to do our drugs. And it's a shame that we can't, but as Shine a Light goes out to meet those people, at some point, we hope, maybe it's the 2nd, the 5th, the 10th time that they're asking them to seek help, that they'll finally come in and seek help. But then there's organizations like yourself, once they make that decision, that we can help them. And I know you help people get their benefits as well. You send them to the right places to get benefits where they can start a new life with affordable housing. And you have several units yourself, hundreds, right? Well,
it's just like an emergency room. You walk into the emergency room, the first person you see is a triage nurse. That triage nurse is the most important connection to people. We have a network where we work with agencies that have hundreds of units, but it's not enough. And it's a supply and demand issue, and the more government tries to do things, and I've been in government twice in my life. I've worked in, out of, and around most nonprofits that are here. And it is a supply and demand issue that needs to be solved in the neighborhoods. This is not an issue that's going to be solved with, in my opinion, and it's with the super center. It's an issue that's going to be solved like we have. We have, an apartment complex, transitional permanent housing, and emergency supplies. and a network of people. Anybody that calls us, I do triage on my handheld now.
That's amazing.
We had a veteran call that reached out this morning. I connected them with U.S. Vets, an amazing agency that's been around for a long time, that has housing vouchers, that can connect them with the HUD-VASH voucher, that can connect them with the medical thing. And we have a tremendous relationship with the VA that took me 18 years to nurture. And I'm not underestimating that. The VA, I think is doing a good job. Could do
Wonderful.
better. We have the VA Mobile Medical Unit, which is a fully outfitted mobile medical unit that comes to us. Just started every third Thursday now. So if somebody comes there that wasn't thinking about, and they don't just help veterans, they help veteran-connected people. And most people either know a vet or been related to a vet.
Well, what I love most about your organization is even through COVID, you were still doing the food banks.
Yeah.
I spent time out there with you during COVID.
You
and
absolutely
you
did.
kept moving forward to help people because, the issue didn't stop just because we went through COVID. And you guys
Right.
were still open and providing water and food and whatever you could. And I admire that greatly.
Well, thank you very much. And, you were there when nobody was there, when everybody left, and I don't blame them because I got COVID, almost died from it.
I remember.
But you were there with waters and supplies. And, I posted a thing this morning, we don't take political sides. And there's pictures of us with all sorts of different elected officials.
Absolutely, which you never should.
We cannot politicize this issue. It is something that affects everybody. It's one of the few common issues.
It's a nonpartisan
If you say
issue.
oh yeah, we got to solve that. Yeah, we got to solve that. Well, how do you solve homelessness? You build houses.
Exactly.
Housing. And you build it aggressively, and you create the incentives for private sector developers to build the housing.
And that's what we're doing, and I
Yeah.
think it's so important. One of my favorite things, Arnie, is mixed use, where people don't know you're doing workforce and affordable
Right,
housing.
right.
And we incentivize those developers with all kinds of different things, including tax incentives.
Yeah, right.
We
Right. Tax
open
credits.
space, whatever we can do to have them help us with the situation. But again, I think housing is an important issue. I also think treating the root cause of addiction and mental health. And thank God we have many nonprofits who are doing that. And I think it's an important issue that we as government officials support that. I love that we don't we know that addiction is a problem, and we look at it and we're there to help. We're not there to criticize, we're there to help.
Well, I will say you're one of the few elected officials that brings that up topic. It's whenever I talk to anybody, it doesn't matter if it's 2 people or 500 people. When you mention these issues, people get uncomfortable. They start turning, moving around in their chair. And it's because a lot of people, it's frustrating. They don't want to be approached by somebody on the street.
Right,
They don't
and-
want to
and-
feel unsafe, that unsafe feeling that most of us get when we're approached.
Right.
And so if we had a master plan, if we had something that was really, that addressed all areas of housing and not just one of them at a time, I think we could really do a lot better than we're doing.
Well, I think the stigma is better, but it like you said, people still get uncomfortable. And
They don't want to deal with it. They
but
want to
that is
relax when they go out.
But that's the problem.
Right.
That is
I
the
know.
problem, and that's why it has to be dealt with. And we all know someone who has suffered a loss because of addiction. We all know someone, most of us have family members that have suffered with addiction. I know I have. And it's important that we take that stigma away and that we deal with that problem. And that's why I'm so grateful for places like Shine a Light, who goes out to help people in their process of recovery, because we're all going to be a better community without addiction and with people who we can put in recovery. So big supporter of recovery I am.
Thank you.
Yeah.
It's a major issue. Years and years ago, we developed housing in Southern California for people with severe mental issues. Housing that's still open now. and different types of things have worked. The problem became politicized, and when it became politicized,
That's when
people started using that to run on, to run against, and so who does that ultimately hurt? It hurts the person that needs the help.
That needs help.
So,
and that's why it isn't a partisan issue, and we all need to work together and talk about it and keep that conversation going,
Yeah.
and not just talk about it, but put action behind it. And so I'm grateful for the time I spent at the city, that we have
Absolutely.
helped other nonprofits like yourself and others, even through COVID, with ARPA money, to make sure that we were helping those that needed it. I'm grateful that as a city councilwoman, I can bring awareness to it. And I'm grateful that I can work on affordable and workforce housing, because it is crucial. And we have a lot of projects going on in the city, and it's going to benefit the community as a whole.
yeah, well, and our organization and myself have been partners off and on with the city.
That's right.
For 32 years.
That's right.
So, and the county.
That's
I'm
right.
I'm one of those rare people that have partnered with both and had success with both.
Because you know what you're doing.
Well,
you
I don't
know
know
this
if we know
stuff
what
like
we're
the
doing.
back of your hand.
It's bringing people together. I know it's a cliche, and the city of North Las Vegas and the city of Henderson. City of Henderson calls us all frequently. We have a homeless person here. We don't know what to do. And we're glad they reach out to us. City of North Las Vegas, I've built affordable housing there and worked with them and their council for years to these various administrations. Same with the city. Now we have a new mayor. It doesn't matter to me who's there. It matters
Who's willing to work on it.
Who's willing to work on it with us. And so when they see me coming, it's like, oh God, he's gonna want to talk about affordable housing and homelessness. That's what we do.
Yeah.
And if somebody wants a solution, they're welcome to contact us. We counsel and mentor lots of nonprofits and businesses. Businesses call us for recommendations on who to donate to. And we become sort of a de facto clearinghouse to connect people, to connect like desires and things like that. Where do we put our money? Where do we volunteer?
Right.
We're driven a vast amount of what we do, and we're a small nonprofit. We don't have PR firms, we don't have fundraisers, we don't have galas, but what we do have is a core group of grassroots mechanics, carpenters, plumbers, electrical workers.
Talk a little bit about that new project you have.
Yeah, it's a remake of something that I've done my whole life. It's called Veterans Village Home Makeover Project, and it is a very simply structured thing. My wife Shannon and myself and our son Jacob really coordinate it, and Shannon makes it drive, and it's a place where a place where somebody can go to through recommendations from other veterans. We have a small veteran council. We just had breakfast
So
with them the other
veterans
day.
recommend other veterans
Yes.
that need help.
Yes, thank you.
Yes.
Yes.
So you have these veterans that live in homes, and maybe they're older now and disabled, and they need a makeover in their home. And so you have a program where you go right in and do what's needed.
With the help of other companies like Penta Building Group and TGJ Painting and some other local contractors, we get a scope of work. Once we have a candidate, we get a scope of work. We go and we do the repairs, no big deals, and boom, somebody's got an air conditioner.
No
instead of
cost
sitting
to the
in an
veteran.
apartment that's 125 degrees in
No
the summer.
cost. No cost to the veteran. I love
No
this.
cost, yeah.
Well, Shared Village is doing amazing things. I know you started out as Veterans Village. You're still helping veterans. You're helping everyone. So
Thank you.
I can't thank you enough for
Oh, me
joining me
too.
on this
Me
podcast
too.
today, because through the years on the City Council, I've had a lot of admiration for the work that you do.
Oh, thank you
Because I know
very
you do it
much.
from the heart. And I've seen the results,
and I
and you're
appreciate that.
saving lives.
Well,
So thank you.
Thank you for having us.